Joining us right now is Dr. Eric Verdin, CEO of the Buck Institute for Research on Aging. Doctor, thanks for joining us today.
Happy to be here.
You know, right off the top, I just kind of want to ask you about your general take on what we have witnessed here, not only in our country, but across the globe regarding this virus, regarding the pandemic.
We're witnessing sort of one in a lifetime pandemic. This is something that many of us in the virology field have been fearing for a number of years. We had warnings that came in the form of SARS and MERS and H1N1, swine flu. Now this is the real deal. We're back to something that last happened in 1918. And so I think this is a very different time at the same time, because we are much more equipped in terms of knowledge, in terms of our ability to fight this virus. So while the situation is difficult, I think there's also reason to hope and that we are in a position to actually alter the course of this epidemic.
Is there one thing in particular that's kind of just taken you back that you never would have foreseen taking place here?
Well, one thing that is a bit hard to understand is the fact that despite all the warnings and what we saw happening in China, and it took us so long to get going. And this is happening again across the country. I mean, there are some areas took very early and active measures, and some are still lagging behind. And the sad situation is that those who wait too long will have to pay a heavier price. And but I think we're on the right track.
Okay. For you there at the Buck Institute, you're starting to get in on the mix, or you have been over the last few weeks here. Tell us what you're doing and who you're working with in regards to trying to find a treatment for COVID-19.
Now, one reason we got involved is the Buck Institute is focused on understanding aging. And early on, even from China, we got data that the elderly and population was especially at risk for not for being infected, but for the complications and for mortality. And we see a direct correlation between how old one is and how much risk one is to suffer complication or fatality from this virus. So this was a signal for us. We've been studying the biology of aging for 20 years. And this was a signal for us to get into the mix and try to bring our knowledge of what is aging to how it might actually interface with the virus and hopefully lead to novel and better therapies or protection mechanism for the elderly.
I mean, when it comes to treatments or therapies down the road, I mean, when it comes to progress, are you in the beginning stages, the middle, closer to the end?
One of the things that's remarkable about this epidemic is the speed at which the science has progressed. So we are at the Buck part of a collaboration with Nevin Krogan and Melanie Ott at UCSF. This is the University of California, San Francisco, which are about 20 miles from us. Together, we are trying to map the proteins that are involved in the infection. That is, how does the virus use our own proteins to actually do its deed, which is to replicate. And so this has very quickly led to the identification of a number of key potential drug targets that we are and will be in the process of exploring together.
Okay. I mean, you mentioned the focus there at the Buck is on aging and on seniors. I'm just curious, I mean, why such a challenge for seniors when it comes to COVID-19? I mean, my immediate guess would be, you know, the immune system of older people or older population playing a role. But at the same time, I have an 81-year-old mother living with me in my house. She's out normal, walking every day, you know, fairly healthy. Her diet could be better. Why some seniors and maybe not others?
Well, first, we know that not everybody ages it the same way. You can have a 90-year-old who is actually more robust than a 60-year-old. And this has incredible relevance in terms of COVID-19, because we know that if you are younger and you are carrying some chronic disease, you are also at increased risk. For example, obesity is a very high risk for complications of COVID-19. Mm-hmm. So it's not just purely your age. It's mostly your age as a reflection of the fact that when you become older, many of us carry chronic disease of aging, and we are familiar with all of those: diabetes, heart disease, chronic obstructive pulmonary disease. All of these are increased risk for the complications. Now, why is this? That is a really important question. You mentioned the immune system is a big one. We know that the disease itself is caused by an overreaction of the immune system. And it turns out elderly people tend to overreact to these viruses in a way that's not appropriate, whereas someone younger might react to the virus, but just enough. So we also know that the virus itself really in some way triggers and interacts with many of these what we call aging pathways. So there's a lot more than just the immune system. It's a really complex picture that we're trying to decipher. And hopefully this will lead to novel targets, novel interventions.
Sure. I want to get your professional opinion on, there's been a lot of talk about the drug chloroquine. The president of the United States has talked about it in order to relieve respiratory symptoms of COVID-19. What's your opinion on that drug?
So early days, but interesting and certainly worth pursuing. The data initially was that the drug chloroquine and a derivative called hydroxychloroquine actually were able to block the multiplication of the virus in a test tube. And so what we know is it's actually quite easy to do this, to find drugs that will block the virus in the test tube. It's much harder to take that drug and give it to someone and actually block the virus replication in the patient. Now, there's also some evidence that, for example, chloroquine and hydroxychloroquine might be dampening the immune response. So this might be the effect that we see in some patients might be due to an effect on the immune system. Now, there's been some controversy about this, especially since the clinical trials, the large-scale clinical trials have not been conducted, and they need to be conducted because this is the only way we're going to be finding out whether this is truly effective.
Yeah, I was going to ask you, what do you think? I mean, does the benefit outweigh the risk? Because it is kind of a two-sided coin there.
Yes, because every drug comes with its complication. And we heard the case of someone in the middle of the country who actually ingested a large amount of chloroquine and actually died from it. So I think, drugs are powerful agents, and I think they have to be treated with the respect. And, as a physician, I was trained to first do no harm. So that notwithstanding, the preliminary results of a very small clinical trial in China seem to indicate that it might be working. But again, it's not a panacea. It had a modest effect in this first clinical trial, which was controlled. So I think as a scientist and as a physician, I think I take the position that we need to see the data. Once the data is really clearly indicating a benefit, then we can recommend it for everyone to take.
There at the Buck again, reminding our viewers here that, again, your focus there is on the older population, seniors and aging. But I'm curious, we've seen a number of people of all different age groups, I guess you could say, pass away from COVID-19. There are estimates, and they're wide ranging here, 100,000 to 250,000 deaths when all is said and done. Not to predict the future, but where are we? And I'll focus in on the United States in regards to getting, they talk about flattening the curve. Where do you think we are right now here at the beginning of the month of April?
Well, we see, I'll just take two examples that are sort of reflecting different approaches. California was very lucky in seeing what was happening and implemented a very early lockdown. So we've been in lockdown for now almost 3 weeks. This was much slower in New York, and there might have been an influx of people coming in earlier. So it looks that New York has went through a form of the epidemic which is much more acute, and the curve was clearly not flattened there. The signs are that California might be weathering the storm a little better, although no one can predict the future. Clearly, I mean, the indication is that social isolation seems to be working, and that if we want to lessen the effect on our population, is really to respect these recommendations of social distancing. So we will see. I think it's very early. New York right now is suffering the brunt of it. we're lagging by 2 or 3 weeks behind, and we will see what happens.
Yeah, I think the shelter in place right now is the best medicine for all. You know, on a personal note, I'm just curious, as the CEO of an institute, you do so much research, so much great work there for everyone here in the country and across the world. What's it like running a place like the Buck right now at these times when you have all these employees and you're trying to protect them, but you're also trying to do good for the greater population?
It's a tough time. There's a lot of anxiety in our employees. So I think my job has been quite transformed, and we do a lot of work at distance as a scientist. I have a number of my scientists who are actually working in the lab right now. This is deemed essential work, so there's an exemption for this. For most of the employees actually are staying at home and sheltering in place. So it's a special time. We're certainly traveling a lot less and using a lot more Zooms.
Yeah, exactly. A lot more Zooms. I'm right there with you. As I sit here in my son's room conducting this interview with the CEO of the Buck Institute for Research on Aging, Dr. Eric Verdin, for all of us here at Fox, thanks for taking the time. I appreciate it. Thanks for all your great work and all your scientists, what they're doing, and be safe out there.
Thank you very much. You too.